the costs have become so high. But what you also have on cost, I think there's actually four things. One is actually the state mandates. Like many states, they add little mandates into each premium. In some states, it's pretty ridiculous. Like you yourself, like if you, I believe, I might actually get this wrong, but like say Iowa, a lot of these states actually have premiums that you pay for hair extensions. Or if you're a male, you may be paying a premium for ovarian cancer. So these actually add up quite a bit. So like 18 to 40% of your premium are for, and you can review these lists yourself. I'll put a link up. Is through it takes up about 18 to 20% to 40%, depending on the state that you live in, of your premium. Mm-hmm. That's one thing. The second thing is actually tort reform. And in Congress today, they talk about tort reform and they give it some liability on the federal level. But really, the federal government has nothing to do with contract and liability law. The tort reform should really be undertaken on the state level, which is it is their responsibility to establish that legal framework.
Yeah, explain for the folks at home what tort really means.
Sure. Like for instance, if you go to the hospital and you tell them that you have a problem with your right arm and needs to be amputated, and they cut off your left arm, you would have a pretty straightforward case that they committed negligence in some manner.
Okay.
Of course, there's also frivolous lawsuits that society also needs to protect itself against, like, for instance, like the McDonald's with the hot coffee and that type of thing. So what ends up happening is these doctors pay absurd amounts, usually sometimes at half of their salary, for malpractice insurance to protect themselves. Mm-hmm. And not only that, but because they're always worried about being sued, they undertake what's called defensive medicine. And what defensive medicine is just tests that the doctor believes are unnecessary, but are done as a precautionary thing, just so that he covers all his bases. Then when you talk to these doctors, a lot of them are actually frustrated about it. They like to treat the patient and get them out of the door as quickly as possible, but instead they kind of need to protect themselves and move ahead at a bit of a slower rate sometimes than they normally like. Mm-hmm. And it appears that it's a pretty significant cost, and it's hard to put numbers on these things, but the estimates that I hear from folks is anywhere also from 20 to 40%, another 20 to 40%.
You know, I want to go back just a minute, Jake, and you mentioned that government intervention basically equates to rationing, higher costs, longer wait times, fewer choices. Why would all of these happen? And I'm going to turn to Meghan. Would you comment on that, Meghan?
Well, first of all, I would like to go back to something I was reading that Jake has posted before I answer that. And he does have a quote on his open letter to flag@whitehouse.gov, and it says, "You cannot legislate the poor into freedom by legislating the wealthy out of freedom. What one person receives without working for, another person must work for without receiving. The government cannot give to anybody anything that the government does not first steal from somebody else." Mm-hmm. And I think that that's food for thought.
That's excellent. And we're back. This is Radio Free Market, and I am your host, Michael McKay. And I have with me today Mr. Jake Towne, who is running for Congress as an independent in the 15th District north of Philadelphia, Pennsylvania, and Ms. Meghan O'Toole, who is a graduate student at Pittsburgh State University in Kansas. And both of these fine people are graduates of Mises University, so they're very well versed in Austrian economics, which listeners are going to recognize that I repeatedly refer to as reality economics, because reality is not optional. And we were talking a minute ago about rationing, higher cost, longer wait, fewer choices as a result of government intervention in healthcare. Why would these happen, Meghan?
Well, first of all, I would like to refer back to a talk that Walter Block gave at the Mises University, and he pointed out an example of what happened in Canada, a letter he received about a woman who owns a horse ranch, and she encountered this predicament where she had to wait 18 months to get treatment for a kidney problem, that if she had, one of her horses had it, then they would have had to have received immediate treatment. Otherwise, she would have been accused of abusing her horses.
That's right.
And Walter Block basically said that he thought that, and I agree with him, that basically the U.S. government should be left to things like manufacturing paper clips and thumbtacks, just so that they don't mess it up.
I kind of like paper clips. I don't want to have a shortage of those, though.
Yeah, I like paper clips too. But I mean, the point is, we're dealing with human life,
right?
And human life is not valued. And human life, a politician may try to convince you that they're being compassionate by enacting legislature that will help the poor and the needy, but at the same time, you have to think, what are their motives for doing that? Why don't they just go out themselves and start a charity?
One of the biggest comments that we hear repeatedly is the lack of health insurance, that people are not covered in health insurance. But this assumes that more coverage is automatically going to equal better health care. Now, why is that a logical fallacy?
Well, it's a logical fallacy because many of these people, first of all, are people my age who probably don't even need health care, and they don't want to pay for it unless they may need it in the future, but they don't want to pay for it right now. And if you make everyone pay, then the quality will actually go down because everyone else is paying for costs that don't even involve them, that go towards and I think you're going to get into Hoppe later on, but he says that it's a breeder of diseases. It actually encourages people with worse health to seek out health insurance and to bring the costs up for everyone.
In other words, if things are viewed as being free, demand will exceed supply.
Yeah, and there is really no such thing as free health care, And as further in that quote by Adrian Rogers that Jake has on his website, you cannot multiply wealth by dividing it, And when half of the people get the idea that they do not have to work because the other half is going to take care of them, and the other half gets the idea that it does no good to work because someone else is going to get what they work for, that, my dear friend, is the end of any nation.
So, Jake, now, the idea of more insurance, does that automatically equate to people being able to have a doctor when they need it?
No, and it's been said, but I'll restate it because coverage, it doesn't mean a doctor or a hospital room waiting for you when you need one. Individual cases always vary, but overall, a system where you have socialized medicine, you do have longer wait times to get to doctors, even if you have this quote-unquote universal coverage. But whenever the government is funding the coverage, whenever you have the state doing it, what you end up having is less actual health care and also less access to it for the reasons that we stated before, namely price signals being destroyed, government-sponsored monopolies, a lot of waste, bureaucracy. And a lot of those actually came about. This is another thing that people don't realize is the government has already put in place the current healthcare system, because a lot of these folks that I talk to, they complain about the current insurance agencies, they complain about basically the HMOs. And the HMOs started in 1973 under Nixon, and what's great is they actually have a line, they actually have this line on tape that came out during Watergate, and it's basically his advisor telling him, well, the HMOs, they'll give you less medical care, the less care you give them, the more money they make and the more profits they make. And, that's exactly what the HMO was put in place. So, the Congress passed this, actually I believe it was sponsored by the Senator Ted Kennedy, who recently passed away, unfortunately. And this HMO Act, well, it was unfortunate that he died, but the HMO Act itself is kind of an abomination, and that actually kind of really started eating into, along with Medicare, the free market in the U.S.
Now, one of the professors at Mises University, and by the way, I want to plug Mises.org, that's MISES.org, as probably the premier resource for understanding